Are you performing complex procedures that take significantly more time or effort than usual, but you're still getting paid the standard rate? You might be missing out on additional reimbursement. In this video, we'll break down Modifier 22, what it means, when to use it, and how to avoid claim denials. What is Modifier 22? Modifier 22 is used to indicate increased procedural services. In simple terms, it tells the insurance payer that a procedure required significantly more effort, time, or complexity than what is normally expected for that CPT code. This modifier is essentially a request for additional reimbursement due to the unusual difficulty of the service provided. When to use Modifier 22? You should use Modifier 22 when the procedure took significantly longer than usual. There were unusual complications or patient conditions. The work required was far beyond the typical service described by the CPT code. The complexity increased provider effort, time, or risk. Example: a routine procedure becomes complicated due to unexpected patient conditions, requiring extended time, additional monitoring, or extra clinical steps. In such cases, Modifier May 22 be appropriate. Common mistakes providers make. Modifier 22 is often misunderstood and underpaid when not documented correctly. Common mistakes include using it without strong documentation to support increased work, not explaining why the service was unusual or complex, expecting automatic extra payment without justification, using it for minor increases in time or difficulty. Important: without detailed supporting documentation, payers will often ignore or deny Modifier 22 requests. Best practices to use Modifier 22 effectively. Clearly document why the procedure was more complex than usual. Include details on time, complications, and additional effort. Compare it to the standard procedure to highlight increased work. Attach operative notes or detailed clinical documentation when submitting claims. Pro tip: the stronger your documentation, the higher the chance of receiving additional reimbursement. Real-world example. For example, if a procedure normally takes 30 minutes but in a specific case takes over an hour due to unexpected complications, additional clinical steps, and increased provider effort, Modifier 22 can be applied to justify higher reimbursement. Modifier 22 can significantly increase reimbursement when used correctly, but it requires strong documentation and proper billing strategy. Without it, you may be leaving money on the table. If you're a provider or practice struggling with billing accuracy, claim denials, or underpayments, ZenMD can help. At ZenMD, we provide end-to-end medical billing and credentialing services designed to maximize reimbursements, reduce denials, and streamline your revenue cycle so you can focus on patient care. Reach out to ZenMD today and let us handle your billing the right way. Scan QR code to schedule a meeting or visit our website.